Hello, in this video, I'm going to talk about chronic heart failure and exercise recommendations. So chronic heart failure is when the heart is not able to pump enough blood to the body to meet the demands of all the different tissues of the body. So signs and symptoms are related to the different tissues, especially muscles, not receiving enough oxygen. So that would be exercise intolerance. So like any amount of physical exertion causes extreme fatigue, shortness of breath, just feeling like they can't keep up with the demand. Fluid retention, so peripheral edema, so fluid accumulation in the peripheral, in the extremities. Recent weight gain, and sometimes both. Orthopnea is difficulty breathing at rest, and dyspnea is difficulty breathing during exertion. So the patient might have either or both of those symptoms. So there are two types of heart failure depending on what is going wrong that is preventing enough blood from being distributed to the body. So if there is systolic dysfunction, it means there's the inability of the left ventricle to contract sufficiently to produce sufficient pressure. So for blood to be ejected from the ventricles, the valves have to open. So the aortic valve and the pulmonary valve, they have to open to allow the blood to be ejected from the ventricles into the aorta and the pulmonary trunk, respectively. The valves don't open until the pressure inside the ventricles exceeds the pressure in those vessels. So it's up to the heart to be able to contract with a great enough amount of force to increase the pressure inside the ventricles sufficiently to cause the valves to open and the blood to be ejected. Now, the longer it takes to build that pressure, the later the valves open. If the valves open late, then there isn't as much time to eject blood from the ventricles before the valves close again. So if the ventricles are having difficulty producing pressure, so they're not able to contract sufficiently to generate pressure early, then that means that less blood is going to be ejected with each beat because the valves are going to open late. So the doors are open for a shorter amount of time, so less blood is going to be able to get out. So the ejection fraction is the fraction of the blood that was in the ventricles that is actually ejected. So higher ejection fraction means that more of the blood in the ventricles is pumped out in circulation. So if the valves are opening late, then there's a reduced ejection fraction. So less, proportionately less of the blood from the ventricles is pumped out. Diastolic dysfunction would be dysfunction while the heart is relaxing. So it's abnormal increase in resistance to left ventricle filling caused by stiff chamber that is less able to expand. So if the walls of the ventricle are abnormally stiff, then they're going to resist the stretch that is required to allow them to fill with blood. So in diastolic dysfunction, it's like the ventricles aren't able to expand and relax enough to fill with an adequate quantity of blood. So even though the ejection fraction might remain the same, so we might be ejecting proportionately the same amount of blood, like the same fraction of blood. If it didn't fill with as much blood in the first place, then that actual quantity of blood will be less. So essentially we're saying that in systolic dysfunction, the ventricles will fill normally, but not be able to eject as much blood. And in diastolic dysfunction, the ventricles don't fill as much and then are able to eject most of what they fill with, or a normal ejection fraction, but they didn't fill with as much in the first place. So in both cases, the result is less blood being pumped with each beat. So treatment includes managing risk factors like stop smoking, lose weight, get blood sugar under control. And then there's other therapies, medical therapies, device therapies, surgical therapies. And then supervised exercise, that would include at least 3 sessions a week, and that'd be under supervision of an exercise physiologist who knows what they're looking for and how to program safely. And then once the patient has demonstrated tolerance of those sessions and that exercise, and the patient has demonstrated their commitment to the program and their ability to complete the exercise on their own, then they can work on a home-based exercise program where they don't need to be supervised. So recommendations for aerobic exercise is that they should be working 4 to 5 times a week or more as tolerated. So if we can do aerobic exercise every single day, that would be good for all of us. So you want to start at an intensity at about 60% of heart rate reserve and gradually increase as tolerated. Keep the RPE at about 11 to 14. Now, ideally, we want them working at least 40 minutes a session and maybe closer to 60, but you might need to start much lower than that initially, depending on their tolerance and their current level of fitness and so on. So you might even be starting with 5 to 10 minutes and have them do that a couple times a day even. Well, I mean, you want them to be supervised, so I guess it depends on the setting that you're working in and whether it's safe for them to do that on their own or not. But you want to start as low as you need to, start wherever they are and build your way up. And ideally, they'll be doing at least 40 minutes a session as they work their way up to being able to last that long. Now, types of exercise to do here. You want to do things that are stable. So like a stationary bike, walking on a treadmill, arm ergometer, but also you don't want them walking around the neighborhood or that sort of thing, because if they do need to stop, if they're having some kind of symptom or they're all of a sudden extremely fatigued or not tolerating the exercise well, you need them to be able to just stop. And so that's why walking on a treadmill is good, is because if they need to just stop, they can, compared to what if they're out for a walk in the neighborhood and they need to stop? What are they going to sit on the curb and call somebody to hopefully come get them? If those things happen, we take them as they come. Those things do happen, but you want to encourage them to exercise in a way that's going to be safe and where they have the option to just stop. Because unfortunately, in that situation where they're out in the neighborhood, they're going to be more likely to just push through whatever it is that they're feeling because they feel like they need to be able to get back home again. So they're going to be at greater risk of causing a cardiac event. Resistance training recommendations. They can be doing full body exercise 1 or 2 times a week. You want to start at about 40% 1 rep max for upper body and 50% 1 rep max for lower body. You should not be testing their 1 rep max. You should be calculating it. But you want to start them at a relatively low intensity and gradually work on increasing that intensity over weeks. So very gradual increase. And so they can be doing full body workouts on these 1 or 2 sessions per week. You want to start with 1 set of 1 exercise per muscle group in each session. And that 1 set would be of 10 reps, and you work up gradually to doing 2 sets of 12 to 15 reps. And again, that's 1 exercise per muscle group. And then if they get to 2 sets of 12 to 15 per muscle group, and they're doing well with it and they're continuing to progress, then you can look toward our normal strength training guidelines in terms of how to progress them safely. All right, thank you for watching, and I'll see you in the next video.